The big change for rugby union, talking about, was the advent of professionalism in 1995, 1996. Before that, it was an amateur game. And I always said that the big difference between the amateur and the professional era was that it was always a hard game. It was a dangerous game. If I've got a patient open on the table and I've got a problem, I can't say I'll come back next week and have a think about it. I have to make a decision. And if I think in the context of traumatic brain injury in sport, there is even a suspicion of a problem. And I'm not naturally cautious, but I am in this, that we need to protect them. And we particularly need to protect the youngsters. I was responsible for the assessment and the admission of all head injuries into my hospital. And I would have to bring, if they needed coming in or scanning, then it was my name above their bed, and orthopaedic surgeons don't have any particular training.
I just wanted to start this episode with a message of thanks. Thank you to everyone that chooses to listen to this podcast. By doing this, you're enabling me to reach more people so that they might learn how to unchain the pain to live a healthier, happier life. The feedback that I get from those that take action and are inspired by the show's content is incredibly rewarding. So I'd like to ask you a teeny tiny favour. You are truly able to change the course of this podcast, the types of guests I have on this show, and everything that I do by doing one simple thing. And that is simply hitting the subscribing button. The guests on this podcast are incredible because so many of you have hit that button. When I think of what I want to do this year on this show, this is fueled by the amount of you that subscribe, that tune in, and that comment on the show's content. So please keep subscribing, keep commenting. Any type of comment, please keep them coming, and keep sharing the shows that you find inspiring. I can't wait to see what this year brings for this show, for you, for my community, and for this platform. Thank you.
Welcome to the show, Brain Health, Unchaining Your Pain. I am joined by the fabulous Bill Ribbans, who joins me on the show. Professor Bill, welcome to the show.
Thank you for asking me, Ruth. Lovely to be with you.
I'm really, really looking forward to this conversation because I know we met at the Ahead of the Game event with Sam Peters, who's written the book on concussed and talking about concussion in sport. So I'm super excited to have this conversation because it's such a needed topic in today's world with all the publicity that we are seeing on the tackles and the actions by those on the field and those reviewing as commentators, as well as the professionals that are assessing whether the injuries have been sustained or not. So I'm really excited to dive into this conversation. But before we start, I would love to know, what are you passionate about in life right now?
What am I passionate about? Well, professionally, I'm still 70 and I'm still working. I love my job as what I now call myself an orthopaedic physician, because I sheathed my scalpel a couple of years ago, having told my patients that they didn't want an old age pensioner with a bus pass with a scalpel in his hand. But I just love seeing my patients and talking to them, advising them, trying to steer them in the right direction. I'm passionate about improving the quality of their lives. And with my other hat, apart from being an ex-surgeon, as Professor of Sports Medicine, is really to push the message of healthy living and quality of life, and what we can do to improve that, both physically and mentally. And from a personal point of view, my family, my wife, my 3 daughters, 6 grandchildren, and just sports. I've tried most sports in my life. I'm now a mad keen cyclist. I always feel that cycling is something that people do when all other sports have given them up. and I try and cycle around the countryside and try and escape abroad whenever I can, just to try and keep body and soul together, Ruth.
Yeah, I love cycling. I'm a massive fan of it, although I don't get so much time with a 6-year-old, but it's such a super sport to get out and about. So you've had quite an extensive career history, haven't you, as a consultant trauma and orthopaedic surgeon and professor of sports medicine at the University of Northampton. And then before that, you've been involved in a multitude of positions in sport itself, and now with your own private practice in Northampton, which is called the County Clinic. I'm really curious to know what inspired you to get into the field of orthopaedics in the first place?
Well, if I go back, my dad was a sports journalist. I was absolutely sport mad, like so many youngsters are now, and I grew up all around professional sport and amateur sport. When I decided I wanted to do medicine, I really wanted to have not all, but a significant amount of my professional life involved in sport and exercise. Now, when I qualified in 1980, there was no provision for looking after sports people. And in fact, the book that I wrote 5 years ago, Knife in the Fast Lane, was really charting how things have changed over the last 40 years. Now, back in 1980, there was no such thing as sport and exercise medicine as a career. In fact, it's only really been in the last 17, 18 years that's been recognised in this country as a specialty. So if I wanted to get involved in sport from a medical point of view, really for me the obvious route was to go via orthopaedic surgery. Now that doesn't mean that all of my patients, but only a minority of my patients are elite sports people, but I've been very fortunate in my career to looked after international teams, national teams, professional teams in many sports. I looked after the English National Ballet for probably about 30 years. So lots of different aspects. So I've been enormously lucky that I've been able to fuse my professional interests and my sporting passions. So that's really how it all came together.
But having obviously started your career at the outset where sports medicine was coming into existence or being born, what has really shifted over the last 20, 30 years, 40 years actually?
Yeah, well, if I go back to the 1980s, then the view of many of my bosses, when I was a trainee and they were the consultants, was that sports injuries were self-inflicted and most people went to the back of the queue. Very, very few of my bosses, wonderful surgeons they were, had any real interest in sport. I think also we knew very little about the athletic body. One of my late colleagues, John King at the Royal London, produced the first ever sports medicine course in the world.
Wow.
And he told me when they sat down to produce a curriculum, they had no idea what should be in that curriculum because nobody knew anything about sports medicine. So those have developed. And as I said, in the last 17, 18 years, we've developed our own group of highly talented sports physicians who work both in the NHS and in the private sector, who I, as a surgeon, liaise with very closely. And I suppose now that I've actually stopped doing surgery, I suppose I work more closely aligned to the work they do than I was doing when I spent most of my working week in the operating theatre.
And what have you noticed? Obviously, your experience has been quite diverse in the context of sport, but really you dialed in on the challenges of rugby and the impact of the injuries that people incurred with rugby. How has that changed over the last 17 years? What have you noticed has shifted in the context of rugby injuries?
Yeah, well, I have to state from the outset that I played rugby till I was 43. and would still be playing now if somebody would pick me. And so I love my rugby. The big change for rugby union, talking about, was the advent of professionalism in 1995, 1996. Before that, it was an amateur game. And I always said that the big difference between the amateur and the professional era was that it was always a hard game, it was a dangerous game, but we all had to go to work on a Monday morning. And that tended to keep the game in check. The moment it went professional, and obviously it's fantastic for that small elite group who can earn their living from it, they didn't have to go to work on a Monday morning. They could go in the gym. And just suddenly they became, as we've all seen, these behemoths. And the game became, as far as I'm concerned, a lot more dangerous. And World Rugby and the affiliated unions like the Rugby Football Union, the Welsh Rugby Union, have never really caught up with this in terms of the welfare of the players. And the problem is that when you're a professional rugby player and you're 25, you're never going to be 45, 55. You think you're invincible. And it's been a hard road trying to teach them about welfare and brain injury, concussion. It was interesting. On Saturday night, I was at Northampton Saints for a dinner, and I sat next to an ex-player who played and captained England, played 50 times for England, and he was talking to me about the changes in his career, how there was that awareness that something had got to be done. It wasn't seen as kind of manly, or in these days womanly, to carry on with a head injury, and that you really had to go off and get attention. So I think it's fair to say that when the game went professional, those first 5 to 10 years, the late 90s and the early noughties, it was the Wild West show, really. And I think the case involving so many players coming and taking the unions to court, the vast majority of those come from that era. But having said that, once again, at that dinner on Saturday night, an ex-player who I'd known since he was a teenager, who's now in his 40s, very good rugby player, he's now 43, 44, diagnosed with CTE, chronic traumatic encephalopathy, young family, and said he had symptoms he realizes now during his playing career in his early 30s. So we do have a problem, and it has to be addressed if the game is going to survive, which I desperately want it to.
And what do you think was the real trigger? Obviously, when it turned professional, what was the big shifter that made it so much more dangerous versus the amateur game? For those people that aren't hugely familiar with the changes that happened in rugby.
Well, as I said, it was the fact that the players could devote themselves full time to developing their fitness and their strength. It was associated with the explosion of disciplines like strength and conditioning. You have to realize that strength and conditioning coaches who are now ubiquitous really didn't exist 30 years ago. So the science has improved enormously. And one of the things that I've often lectured about and I've written about in my books, is whether actually we're the problem. Am I, as a doctor and a surgeon, are the physios, are the strength and conditioning people, are we the problem? Now, it's like asking turkeys to vote for Christmas. But the fact that I was capable of operating on people and with improved techniques, putting people back on the sports field who 30 years ago wouldn't have got back for the next big hit. The fact that we've got scientists who can now make these people so fit and so strong that their machines, their bodies are are just too dangerous now.
Mm-hmm. So too heavy and
Yeah,
too
fast, too strong.
Yeah.
We're never going to be able to turn the dial back, but we've got to.
Well, I mean, you could turn the dial back on weight because it's force per unit area is the it goes back to physics, doesn't it? So you could turn the dial back and say you're not allowed to play if you're over a certain weight.
There has been a view that, and I believe it does happen in the Southern Hemisphere, particularly New Zealand, where you have teams. It's a bit like rowing, with a heavyweight crew and a lightweight crew, that you have teams according to weight. Or you could say, for those who are not rugby aficionados, you've got 8 forwards. You could say, well, the combined weight should be no more than this number of kilograms. It's up to you how you distribute it amongst the 8 of them, but they must not get over this. And there's lots of other things that we've advocated. The use of tactical substitutes, you see. I mean, when you can change half your team, it becomes a different ball game, literally. And it changes the physique. If you've got a great big prop or a hooker who's got to play for 80 minutes instead of coming off at 50 minutes, they've got to have a different physical makeup and fitness. They've got to have more endurance. So we advocate reducing the number of substitutes to make people have to last 80 minutes.
Okay.
And so that one tiring player is tackling another tiring player, rather than some fresh 20-stone player coming on and running around like a demented bison.
Well, I think the game has changed as well, hasn't it, in terms of the tackling? It's become hasn't the way in which they tackle now in professional rugby shifted from how they used to tackle?
Absolutely. And for me, one of the biggest, we're kind of getting into the minutiae of rugby, but and you have to remember the laws have never changed. But it used to be that if you had the rugby ball and you were tackled, the moment your knees hit the ground, the ball, you had to release the ball. Now, the referee takes it very differently, as I've written about. I mean, you can adopt more positions than in the Kama Sutra, holding on to the ball until you're ready to give it to one of your teammates. And that means that tackling has had to change. So people don't tackle below the waist. They tackle less below the waist, and they tend to want to try and take the man or the woman and the ball together to wrap them up. And also, a lot of the sides will practice double teaming, double tackling, and I think that's very dangerous because the first person stops the man or the woman carrying the ball, and then the second one hits them very hard when they're off balance, and that increases injuries. And as you know, the other aspect, because you're tending to tackle higher, because you're trying to wrap the player with the ball, that increases the risk of head contact. And I do think there's been changes. The referees have now got much tougher on this. We'd like them to be even more tough about it. Players have got to tackle lower and lower.
I think it's so important that we kind of really reflect on that, just to frame how rugby has shifted. And I'd love to dive into now what progressive rugby is and what it's trying to do to change rugby to make it a sport that people want to continue to play, but make it a safer sport.
Yeah, for those of your viewership that don't know, progressive rugby is a group of people which I'm intimately involved. That we have several functions. I suppose our main function is just to observe and to keep the pressure on the rugby authorities on the welfare of sports people. Also to keep abreast of the scientific literature, so that we can talk, with reasonable authority on where we believe the science is at the moment, and also to try and advocate change. But we started in February 2021, so we've been going for 4 years. It's been quite onerous. We've had meetings with World Rugby several times, the Welsh Rugby Union, the RFU in England. It's a hard sell. And one of the great disappointments for me, Ruth, is that America has gone through this 10 to 20 years ago with American football.
Yeah.
And they had this enormous number of professional players who had committed suicide, who'd got long-term neurodegenerative diseases. And when I tried to raise that subject with the authorities, they just told me, you cannot compare rugby with American football. And I think absolutely you can.
It's absolutely nonsense.
Yeah. So why try and reinvent it? And I have had to. They're a bit. Well, they are politicians. They try and kick the decision making down the road by saying, well, there's this study and this study and this study going on, and we'll have some results in 3 years, 5 years, 10 years time. And I say, look, you have to excuse me because I've been a surgeon all my life. If I've got a patient open on the table and I've got a problem, I can't say I'll come back next week and have a think about it. I have to make a decision. And if I think in the context of traumatic brain injury in sport, that there is even a suspicion of a problem, and I'm not naturally cautious, but I am in this, that we need to protect them, and we particularly need to protect the youngsters. That's what I feel very strongly about. And rugby union will wither on the vine. I mean, we know it has not picked up since the pandemic. Playing numbers at adult and student level dropping, and it won't be the final decision on what happens with rugby union won't be down to me and my colleagues in progressive rugby. It will be down to the decisions of parents, the decisions of schools. It may well be the insurance companies, because, for instance, in Australia now, some of the insurance companies for Aussie Rules football and Australian Rugby League are now excluding the long-term consequences of head injury from insurance. So if people are being excluded or premiums are going through the roof, that's going to be a very positive way of bringing about change. And of course, whatever happens with this legal action, which we're trying to stay completely an arm's length from.
I think it's so important to reflect on the American professional football in America case, because it's like, if we go back sort of 40, 50 years now, when seatbelts first came out, they came out by Volvo, and I'm going to go off topic a bit, but they came out to stop people from having major trauma in the event of a car crash. And Volvo was quite a good vehicle in terms of perceived safety. It was one of the vehicles that you thought, well, this is a fairly safe car. But nobody says it. Sorry, if you're driving a Volvo, it doesn't apply when you have a car accident, because Volvo is the best brand. And but if you're driving a VW, I'll pick any brand, doesn't really matter. The rules of impact don't apply. I mean, nobody says that. Nobody says that when they put a crash test dummy in a car and throw it at a wall at a certain speed. It doesn't matter what car you're in. Your brain is still moving forward at the speed that the car is traveling, your skull is the blocker to stop your brain going through the window, or the window is if your skull smashes into it, and you're still going to incur brain trauma irrespective of which car you're in if you don't have a seatbelt on. The same applies to football, rugby, boxing. It is immaterial what type of sport you're playing. It is physics, it's force per unit area on your skull, the speed of impact, the areas of your brain that you impact, and how often you do it that matters. And I just find it so shocking that rugby union and all of these people who are so-called professionals use this thing that, oh, it's because it's a different sport. It's got absolutely nothing to do with it and everything to do with force per unit area. So I just find that whole thing completely dumb, just phenomenal that they even think they can use that as an argument.
Yeah, I mean, there's a lot of kind of to take on what you've said. I mean, I was working as a junior doctor when seatbelts were introduced, and you remember the kind of the outrage of the effect it was having on social liberties. But they even employed, didn't they, Jimmy Savile to be the clunk click king, to try and persuade everybody not to. But the difference I saw as a young casualty officer working at Luton and Dunstable in people who were wearing seatbelts and who weren't, on massive M1 pileups was quite phenomenal. But no, you're absolutely right. I mean, nowadays we just don't feel safe, do we? If we or anybody in our cars are not properly protected. And I just hope that kind of rugby, kind of picks up those messages. And I mean, we can never, ever make any contact sport absolutely safe. Mm-hmm. But I mean, now that rugby is a professional sport, it is governed by exactly the same rules as any employer has over their employee, and they have a duty of care to make sure that their employees are looked after and they're not put to unnecessary risk. And I don't think that message has really got across. I mean, it's very difficult because we found ourselves in the firing line. We found ourselves in the firing line from the rugby authorities on one side, and then on the other side, we've got people who have accused us and parents of child abuse because we won't come out and say that children should not play rugby. There's a very kind of active and reasonable debate about when youngsters should be allowed to tackle. And I think there's so much research needs to go onto that. And I've been very careful in all my answers to say male and female, because obviously female rugby is probably the most rapidly growing sector of the sport. And women sustaining concussions or brain injuries, the evidence is that they are concussed more frequently. They tend to take longer to recover. Often the mechanism of injury is different, but one of the really significant things is neck strength. Your ability to withstand an impact. And even when they put in to the women's premiership, professional women rugby players, really carefully thought out scientific neck strengthening programs, they still struggle to increase their neck strength. One of the things, going back to when children should tackle, I'm very interested because I don't think anybody has the data anywhere in the world as how teenagers' neck strength grows naturally. And I think we may eventually come to a view that you can actually say, well, if somebody's going to be able to withstand an impact, that their neck strength should be this much, and until that 12, 14, 15-year-old, whatever it is, has attained that neck strength, then they shouldn't be involved in tackling. I think it's one of the way forward. And the other thing you did say was about how injuries are sustained. The science that we feel is probably most important is that, yes, kind of direct impact injuries are important, but actually the injuries that probably do the brain most injury are kind of when the brain gets spun within the box. And we also have to remember, for parents and teachers out there, is that it doesn't have to be a direct head impact to cause a concussion. I mean, you could, a youngster can be running with the ball and then be hit really hard, chest and below, and the whiplash effect causing their brains to spin can be enough to produce changes that's consistent with concussion.
Or they can just be thumped on the floor quite hard but not actually hit their head, and that actually the impact of the fall is sufficient enough to cause problems with their neck or brain trauma.
And back to kind of women in sport. I mean, there's been a lot about kind of female footballers and anterior cruciate ligament injuries in the press. I've been on telly talking about it, and it's the same with brain injuries. I mean, the hormonal environment of the female is clearly very different to mine, and we know that there are certain times in the menstrual cycle when a female will be more likely to rupture their anterior cruciate ligament in the knee, and also it may well be related to how well they're able to resist and recover from a concussion. So there is
you've got your pituitary gland, haven't you, as well, right in the center of your brain, that can be displaced or damaged with a major head impact or brain impact, if you will.
It may well affect the hormonal outpouring from these pivotal glands.
So much to consider when you put your child onto a rugby pitch. In the context of change, what have you seen change since, if anything, since progressive rugby has come into being? What's been the big shifters?
The big shifters, and we can't claim credit for all of this, but the first is increased awareness. That players now are far more aware. And I see that if I'm the pitch side doctor in a game, I'll see the players some of the players sometimes looking over to me and saying, so-and-so's looks a bit groggy. I may have missed it in everything going on. So the players are really looking after each other. The referees are so much better. The referees, say to me, they don't know who I am. They just say, I don't care what you say, this player's going off, which is so there's increased recognition. The tackling has obviously, bringing the tackle height down has been really important. If you go back even 4 years looking at the Six Nations rugby tournament, you see people going into where the ball is, what we call the breakdown, and the players are going in almost horizontal, like Exocet missiles. They're not doing that now. So I think that's important. One of the things that we feel has been a problem is return to play. Now, it used to be that it was 21 days. If you had a documented concussion, it was 21 days. Now, you have to admit that number was plucked out of the air, but that's what it was. It then got down to, for the professional sport, 6 days.
Where does that justification come from?
The justification came from the fact that professional bodies say, well, we've got, and they also try and close down any argument by saying we've got world-class doctors. which is, well, I better not say what I think about that.
That doesn't justify a reduction in duration.
No, because
you could have a world-class car, but you'd still hurt yourself in a crash.
Well, the problem is that we don't. The tests. We may want to talk about this a bit later on. The tests that we do are just not sophisticated enough.
Yeah.
And what we do in rugby, football, cricket now, pre-season, the players do a pre-season concussion testing. Now, in the past, they all used to cheat. They were told to cheat by the other players and even by the doctors. So to appear as thick as two short planks when they did this test, because that score was used as a baseline to see when they'd recovered. Now, I think we're much better at that now. But not having any symptoms does not necessarily mean that your brain has recovered. It's just that we're not sophisticated enough to pick it up. And this is why we desperately need objective tests to understand when a brain is recovering. And then the other thing, Ruth, that we don't know with sport and head impacts is whether it is one big impact that's the problem, or is it cumulative impacts during a game, or is it cumulative impacts in a season or in a career that's the problem?
Or over your lifespan.
No, absolutely. And we just like boxing, they used to talk about certain boxers having glass chins, and that may come about through too many concussions. But some people are just genetic. One of the things we're looking at are the genetics of all this. Some people are just genetically more predisposed not to recover well than others, and we're not sophisticated enough to be able to tell that. And ethically, is it right to take a 16-year-old and say, right, we're going to genetically test you, and I'm sorry, you've got the wrong genotype, that I don't think you should be playing rugby. That's a big thing, and I don't think ethically we're there.
I think that's the real challenge, isn't it? To get the right tests that set the baseline, whether that's genetic testing, whether that, there's so many different factors that lead to cognitive decline. And from, working with the Yeoman clinics, we look at the 11 risk factors that relate to cognitive decline, and head injury is one of many, or head trauma is one of many, but you can't exclude all of the other ones that lead to cognitive decline, because so many other factors can trigger you into a downward spiral, and combined, the situation is worse. But what I do know is that there are studies out there back in, I think it was in 2001, where if you have one major concussive blow, you double your risk of developing dementia, and two major concussive blows, you quadruple it. So, we know from scientific research that the more impacts you have, the greater your risk of developing dementia in one way or another. And it's knowing how to track and trace that, and also how to recognize, is it an indirect or a direct impact that we're going to count, as it were, in terms of the number of concussive or non-concussive blows people have had, and over what window of time do we do this assessment. So typically when I have clients come to me, we assess it over their lifetime, and the more people have, the greater their risk. But obviously for professionals that are playing in a sports field, they could have this, that number of concussive blows that an average person would have over their lifetime in a single season.
Oh goodness, yes, almost in a game. Another thing which has come over from American football is everybody thinks about the games, but the players spend most of their time on the training field, practicing everything they're going to do on a Friday night or a Saturday afternoon. And we've now, it has now been reduced, the amount of time that they should be doing impact. and that's come over from American football. And the other really important thing that we know from high school studies in America is that using very sophisticated MRI imaging, you can look at high school players of American football, and they scan them at the beginning of a season, the middle, the end, and then before they came back for the next season, after they'd had a few months rest. And most of them, even if they'd not got concussions, did show some deterioration over the season, but they'd had 3 or 4 months, then they would come back to their baseline. And I think it's really important that everybody from kids, up to senior internationals, must have protected time during the year of ideally a minimum 3 to 4 months when they're not challenging their brains, to allow everything to recover.
And I think it's interesting, isn't it, that what is recovery? So it might not necessarily just be rest, because when you have a damaged brain, that might not be enough simply just to rest, because the time taken for your brain to recover in that rest period may be a lot longer if you're suboptimal from a nutritional perspective or anything else, supplements and so on, or there's other factors going on in your life, versus somebody who's optimizing their nutritional intake, the supplementation that they use to optimize their brain health. So that can have a huge impact on how quickly people can recover and restore their cognitive health.
Yeah, absolutely. And talking about this, so an individual's susceptibility to both a concussion, their recovery, and long-term risk is so multifactorial.
Yeah.
And you hear sometimes the rugby authorities say, okay, so they had concussions, but we know most rugby players are boozers anyway, so that's another risk factor for them. So we can't kind of tease out. And I always say that I doubt whether there will ever be an absolute gotcha piece of research that proves the cause. So there's an association between impacts and long-term brain damage, but actually proving causation is more difficult. And I always use the example in the 1960s of proving that cigarette smoking caused lung cancer. Now, we think, well, of course it does. But in the 60s, there were still lots of scientists, lots of doctors who argued against it. And it was gradually building up the evidence. Is what I was saying earlier on about being a surgeon and having to make a decision. So it gets to the point where the weight of evidence is so overwhelming. And I worry that the rugby authorities are waiting for that gotcha piece of research, or hiding behind the fact that it hasn't occurred. And they're just so difficult things to do.
And I think it's difficult because when you look at rugby, there's different ways to play rugby, as it were. There's different types of rugby game anyway, just in the context of rugby itself. So you're not going to be doing a like for like comparison in the different game types, are you? But nevertheless, I still stand by my statement, is the more physical impacts that people have, and I know they have, they monitor players on the field in football, and they do in rugby as well, and they've got accelerometers and so on that are now being built into I think it's mouth guards and so on to track how
we've been looking at those, Ruth. So so they're introduced for the Six Nations in January 2024.
Yeah.
And they set kind of an arbitrary impact that if it was recorded, it would be more that would mandate the player having to come off. I mean, it is a research tool because, as I said, we don't know. And we've been looking at them. So I'm a school governor at my old school. Our under 15 team won the national championships last week. fantastic rugby school. So we've been putting the mouth guards in, just trying to see what happens. And there is a problem because they video the games as well, so we can see where the impacts are on the mouth guards, and then we can go and look at the videos. And some people, who are not involved, kind of like a fullback, right at the back of the match, kind of is recording all these impacts, and we think, well, nothing's happening. And then if a player, when the forwards gets lifted in the line out to catch the ball and then comes down again, then that's recording an impact. So we've still got a long way to go on this. I mean, I think it's a great tool, but we've got so much to learn about what's important.
And I think we don't know, do we, yet? What is too much of an impact versus weight and angle of entry to the ground, as it were, because there's so many different factors that constitute, is it going to be a traumatic impact, or is it something that somebody is not going to be traumatized by? And there's not, because it's a 3D, it's a 3D game, isn't it? It's not just two-dimensional.
And if you've got an under 15 second team match being played, they're not going to have any backup. It's just impossible. If you're playing kind of men's or women's senior rugby and you're playing for a junior side.
And knowing what you know now, what would you say for you optimal brain health is in the context of the experience you've garnered over the years that you've been an orthopaedic surgeon?
Well, optimal brain health is, begin when we're talking with youngsters, it allows them to I mean, everybody's ultimate brain health is going to be different. We know that our brains don't mature fully until we're 25. So for youngsters, we need to protect them and allow their brains to mature on an intellectual, problem solving and emotional sense to their maximum. I think for adults, optimal brain health is allowing somebody, the inevitable decline that we all see, that I see in myself all the time, but there is a natural reduction in cerebral function with age, but that what we want that to be is to be natural and not to be accelerated as we get into our 30s, 40s and 50s by repetitive injuries. And as I said, you've not just got to look at the intellectual side, but all the other aspects, the memory, the emotional side. And going back to the kids, what we always emphasize, it's often not the gym teacher that notices the problem. It's the rugby, it's the mathematics teacher who notices on the Wednesday that their student is not in their algebra the same way that they did the week before, having had a bang on the head.
Yeah, I think that's really key, isn't it? Because we have this perception, whether it's in medicine or as parents or people in the school or community, that when you have a concussion or a non-concussive blow, you're going to immediately experience an effect that's going to inform you that you've had a concussive or non-concussive blow. But the reality is that's not how our brains work. That because our brains can't actually physically feel, it takes time for our brains to express what is wrong, and it does it in a different way. So we see changes in behavior, we see changes in limb function, we see changes in mood, we see changes in sexual function or dysfunction. There's so many ways that your brain tells you that something is up with your brain, but it's not the typical way that the rest of our body might express pain.
Yes, absolutely. And it can be very, very subtle. And it can be, not for some time that the penny drops, with parents or the individual, like this player I was saying who came over to talk to me on Saturday evening, said he just couldn't, he was actually playing at international level and realizing that things were just not right. And that's, that's so sad. And I mean, I always feel that the clinical setting of looking after and assessing brain injury is a complete Cinderella area. And if I just think about it from a medical point of view, you might say, well, what's an orthopedic? People might be saying, what's an orthopedic surgeon talking about this? Well, in the United Kingdom, orthopedic surgeons, during my long career, I was responsible for the assessment and the admission of all head injuries into my hospital. And I would have to bring, if they needed coming in or scanning, then it was my name above their bed, and orthopedic surgeons don't have any particular training in neurosurgery. I certainly, but I was responsible. And then you get the neurologists who are so busy dealing with, multiple sclerosis, migraines, all the other problems. Trying to deal with a concussion is not really something high. The neurosurgeons, bless them, so I'd be responsible for admitting head injuries, even if there was a neurosurgical unit in the hospital. They were only interested if somebody needed a hole putting in somebody's skull. The rest of them, and then GPs don't have any training. So
and then your psychiatrists don't liaise with the neurosurgeons or the orthopaedic surgeons when people are presenting with mental health issues that could be the root cause, could be head trauma.
So it's very much a multidisciplinary approach, Ruth. And we know the health sector is incredibly stretched. But the first bit is that we need to provide the appropriate basic training for all medical students and junior doctors coming through. And sadly, historically, that has not happened.
Is that happening now, do you think, or are we still far away from that?
I think it's very difficult for me to comment on that. My daughter qualified 12 years ago. I don't think she certainly had any specific training in it.
Yeah, I mean, we from a functional medicine perspective, which is kind of like the new wave of medicine, is well recognised that there is insufficient training in nutrition and gut health and how all of the different organs of our body are connected with one another. Historically, the brain is kind of certainly from a psychiatric perspective has kind of been dissociated from the rest of your body, and you just look at the head. But we know that it's all intrinsically connected, and our brain is the driving force behind most of our organs. And so you have to look at it from an integrated perspective, don't you?
No, you do. And several papers have demonstrated that athletes coming back from concussion back into sport have not only an increased risk of reconcussion, but also of sustaining injuries elsewhere. Now, people argue why that should be. I mean, some people say it was just simply deconditioning because they've been out recovering from a concussion. But it's also because of what you said, these subtle changes on your balance, your spatial awareness, your coordination that may, all add up to increasing an athlete's risk of going over on their ankle, damaging their knee ligaments and things like that. So you, as you said, you can't look at this in isolation just as recovery from a head injury.
Yeah, I agree. And what do you think the future might look like? And I love the fact that you talked about what optimal brain health is for kids and how it's different for adults, because no one on the show has talked about it in that way. And I think it's really important that we reflect on children's brains are still developing, and they develop, like you say, up to 25 on average. 28 in males tends to be they develop earlier in females versus males, which we don't really know fully why. But what is the future hold in the context of progressive rugby and children's sport?
I think, once again, based on as much scientific data that we can, we've got to come to a view, and I've discussed some of the ways we might do that, about when true impact should be introduced at what age group. So at the moment, tackling comes in around 9 or 10. Some people argue that's far too early. You're probably aware that in certain states in America and in Scotland, in football, they're not allowed to head the ball under 12 and things like that.
Yeah.
And I think we will see that introduced. I think they'll with kids, they must be much stricter about probably how much game time they have. I mean, one of the things that I think we kind of touched on is that an athlete may play for their school on a Saturday, and then they'll play for their club on a Sunday. And people are trying to do something about this now, but there's no linking. So who's responsible for the child getting concussed on the Sunday for telling school this child's been concussed? Or if they've concussed playing rugby, they'll still go out and play. They may be told you can't play rugby for 21 days. Who's telling them they can't play basketball or something like that?
Yeah.
So there needs to be a much more coordinated approach. I just feel, and once again, the science isn't there yet, but I just feel that if we can protect our youngsters and we can get through into early adult life with no or minimal sports-related brain injuries, then even if they are unlucky enough to have a bad collision when they're 25, 26, they'll be more resilient to it than if their immature brain has already sustained these injuries.
And do you think there'll ever be a time where, if we look at the brain age, if you wanted to take in what might be considered an extreme view or a very sensible view, depending on what part of the spectrum you're on, we could just say, based on the evidence of when brains mature, no contact until the age of 25, or, for females or males, or 28, if you will. And you just eliminate contact until the brain's fully developed.
That's not going to happen because certainly playing out on the wing, my career was over by the time I was 28. I mean, that's another thing. Do you have to look at positions? Kind of is one of the 8 forwards going to be more likely to have neurodegenerative disease than somebody who's out on the wing getting cold because they're only going to get 1 or 2 passes in 80 minutes.
Yeah.
So you do have to look at that. In a professional sport that has got to make money to survive, on television contracts and filling huge stadiums like Twickenham and the Millennium in Cardiff, that no one would accept. You've got people of 20 now making their debut for England. Northampton lad did in Cardiff the other Saturday. But there may be that as they come through, we need to limit more their game time, their recovery time, and hopefully we're going to have better means of measuring it. Saliva is something I'm looking at.
Yeah. Because
looking at people's microRNA expression after impact, I hope eventually we'll find out which microRNAs are important in people's saliva. And back to your thing about road traffic accidents, it was the neurosurgeons first found this in road traffic accidents when they looked at the saliva of somebody's head had gone through a windscreen. They found that their RNA in their brain that came out, crossed the blood-brain barrier and was in their saliva. So that's what you're testing.
Wow.
And I think that
was presumably by force, is it? Because of the force of the impact, the RNA out through the blood-brain barrier.
Yeah, the blood-brain barrier. It may be because there's increased amounts of microRNA produced.
Yeah.
It may be that the blood-brain barrier becomes more permeable for a while after injury.
Yeah.
But once again, we're looking at this in students, school children, looking at their baseline microRNAs, looking at what happens after a game, because I think this may be able to help us look at recovery.
Amazing. And I think it, you know, I always want to, I love to put challenges there. You know, if we go back to the seatbelt analogy, nobody wanted to put on a seatbelt 50 years ago. You know, there was huge resistance to changing the status quo, but how many thousands of lives have been saved? We're still driving cars, we still drive them at a breakneck speed, we still do racing, you know, people still die, unfortunately, in road traffic accidents and have severe injuries, but the likelihood of life-threatening injuries has been significantly reduced, and cars are still made. I do think there is a case that, you know, there is resistance, of course there is, because it changes the way the sport as everybody knows it, same way as it changes the way we used to enjoy driving cars without seatbelts. But I think there is a future where there is the, you know, rugby still continues, but it might be, the game might be quite different to what it is today, but it will still be rugby, as it were. And I know there'll be loads of people that will say, no, Ruth, you can't change it. But there's always a case for change.
The argument is that any game, and particularly rugby, evolves and changes all the time. The way it's played is never static, and I always have to be wary of the fact that, you know, that I'm seen as an old dinosaur who wants everything to be as it was in the amateur game. You know, when you could play the game under, you know, I mean, I was under 10 stone when I played, you know, and as I say, they wouldn't let me take the halftime oranges on now. They'd be worried about my safety. It evolves and changes, and there's no reason why it can't evolve again. I mean, it has to retain its core excitement.
Absolutely.
You know, that makes players want to play and spectators want to watch.
I mean, I think about football. We just digress slightly to football, which is contact sport as well. And, you know, the fact they've cut out heading the ball at age of 12. What if they just cut out heading the ball and they just focused on the word football and just use the word, you know, the feet? It could make it quite gymnastic. You get different injuries, of course, and people would be trying to do some fantastic, you know, moves to get the ball with their feet, but you would take away the head contact in football. I think it could make it for a really exciting game. With, you know, it would change the way that you would train.
They have tried trials of games in the last year or two when you can't head it. Don't get me started on football, because we'll be here for another couple of hours. In many ways, they've been more backward than rugby. I mean, you know, for my age group, England winning the World Cup in 1966. You know, I was lucky enough. My dad took me to see one of the games. You know, when you look at the 11 that played for England on July the 30th, 1966. One, the captain, Bobby Moore, died early because of bowel cancer, but 5 of the remaining 10 have all died because of pre-senile dementia, you know, of probably CC. So half of them died early. And is that just a coincidence? I don't think so.
No, it doesn't sound like a coincidence.
And so what you're saying, I mean, I can see eventually some changes to football. I mean, once again, you see people say, oh, well, you know, football, when they used to play, it was the old leather panel balls, you know, the pitches were awful, you know, and after they'd played for 60 minutes, you know, on a mud field, the ball was so wet and it was just like a bit of concrete. And so that increased risk. The new balls just fly at such greater speeds. You could argue, back to your kind of force and mass times acceleration, etc., that the new balls are dangerous in a different way. Just the speed at which they fly around. So I could foresee possibly in the next 10 to 20 years of perhaps heading being limited to the penalty area only, or something like that, just to reduce the amount of impact. They are supposed to be reducing in training, like in rugby, the amount of headed balls, they do, but nobody knows really what goes on behind closed doors. And it's a bit like rugby. You will get some dinosaurs of coaches who just say, we should do it as we've always done it.
Yeah, a lot to do and a long way to go for us to truly understand the long-term impact of contact sports when children start at such a young age, and how that will affect their brain health trajectory. So it's such an important topic. What one piece of advice, Bill, would you give anybody who you started off the conversation as a parent and a grandparent? So what would your advice be for any parent or grandparent who's concerned about their child's cognitive health or brain health following an injury? What would your advice be if they've been involved in rugby or football or any contact sport and they've noticed some shifts in their cognition?
Well, I think the first thing is to err on the side of caution. Your first port of call always in this country should be your general practitioner, if you can get an appointment, but children should have priority. If they feel they're not getting anywhere, then clearly there are professionals like yourself around. Within the NHS, there are sports concussion clinics, too few at the moment, but University College in London's got one, Birmingham's got one. So if parents really feel that their youngster has had one or repetitive concussions from which they do not appear to be recovering, then ask their GP if they can be referred. There may be a little bit of a wait, but that's where you're going to get the best advice, is to go with people who are dealing with this all of the time. And I'm asked all the time, would you let your grandchildren, I've got three grandsons, and the granddaughters are not old enough to play yet, but the grandsons, all under 11, they've all played a bit of rugby. Two of them, their father was a professional rugby player and their uncle played for England rugby. They're actually holding them back until they're 11 or 12. So they're playing football, they're playing tennis. I think, when you're young, you want to try as many sports as possible. The New Zealanders, I forget what it was either kind of 10 by 10 or 11 by 11. They said, by that age, you've got to try all these sports. Get kids to try lots and lots of sports. I know the pressure is on enormously to make them come down to one sport and just train and train and train. But I think just try lots of different sports and don't just concentrate just on the impact sports all the time.
I agree, and I think there's so many sports out there, and it's all about having fun at the end of the day for kids, isn't it? And that's what we need to remind ourselves as parents. It's about them enjoying themselves and having fun.
If you can't enjoy, even if a young boy, a young girl gets picked up by a professional football academy, their chances of becoming a professional footballer are about as much as winning the lottery. So just enjoy it, for what it is. It's particularly team sports, which is where I've been. I've still got friends, that I played football and rugby with, at primary school and senior school that I see. They're fantastic. They're fantastic for so much more. And that's the argument for all these continuing, is that they give far more than they potentially take away.
It's the teamwork, isn't it? As they say, teamwork makes the dream work. It's actually children learning to connect with others and learning how they can leverage the skill sets of each other to the benefit of winning the game. Yeah,
but also learning how to lose as well, which are important life lessons, Ruth.
Absolutely. Bill, it's been an absolutely fascinating conversation. Thank you so much for sharing your insights and wisdom. How can people get hold of you, learn more about the clinic?
Well, they can go into my website, which is Bill Ribbans at billribbans.com. Always happy to see people. Northampton's fairly well centred. Although I'm very proud Northamptonian born and bred, I always say it's a good place to be able to get away from. Our Birmingham, our London, our Oxford, our Cambridge. So, but we've got a great group of of clinicians in various specialties around. So, and I must say thank you very much, Ruth, for inviting me onto the session tonight. It's been a real pleasure, and it's been great getting to know you over the last couple of months.
Oh no, you're most welcome. And remember, everyone, this show is all about brain health, unchaining your pain. And Professor Bill Ribbans here has been talking about rugby and also the role of progressive rugby. So do check out their website too. And remember, you are not stuck with the brain you have. You have the power to make it better. And we've been talking about how you can do that on this show. Thank you so much for joining me. Such an important topic. Thank you.
Thank you.